It's important to acknowledge that although your selected treatment is an elective surgery, there are, as with any surgery, risks and complications that you need to be aware of. The complications that can occur during the surgical procedure include excessive bleeding, blood clot formation, and adverse reactions to the general anesthetic. There are also complications that can occur after surgery. Infections can be quite problematic and have to be taken seriously if they occur. If you are affected, it will become apparent in the first 2 or 3 weeks after surgery. A mild infection, such as a wound infection, will easily settle down with antibiotics. The package price you pay for your tummy tuck will cover the cost of dealing with any infection. Internal bleeding is another potential complication. This usually occurs immediately after the operation, but can very occasionally happen up to 2 weeks later. If there is bleeding present, you would need to return to the operating room for further surgery. You're likely to spend an extra night in hospital and might be more bruised than expected, but everything should settle down over time, and it's unlikely to affect your final results. After surgery, it can be common to experience some alteration in skin sensation. You may initially feel some reduced sensation or numbness in certain parts of your stomach or rarely your upper thighs. However, this should only be temporary and will resolve itself within a few months after the procedure. Another complication that can occur is the development of a seroma. This is when there's a buildup of fluid underneath the skin, which most commonly occurs at the incision site. To reduce the risk of a seroma developing, drainage tubes are left in place after surgery to drain excess fluid buildup. During a tummy tuck procedure, the blood supply to the abdomen may be disrupted. This can result in damage to the skin and tissues around the stomach, which is termed tissue necrosis. If the disruption to the blood supply is large enough, it may result in tissue death or skin loss in that particular area. Depending on the amount of tissue affected, the damage may resolve itself within a few weeks, or you may need to have further surgery to remove the dead tissue. As tummy tuck surgery requires incisions to be made, minimal scarring is unavoidable. In most cases, however, the scars are relatively mild and will become thin and barely visible over time. Although, unfortunately, the scars are unavoidable, there are many scar-reducing techniques that can be found in the post-operative guide we will send you. Your surgeon will be able to discuss the risk of developing all these complications with you in further detail during your consultation. It's sensible for you to be aware that there is always a risk that you are not satisfied with the aesthetic result of your surgery. We therefore advise patients to choose their surgeon carefully and make sure that he or she fully understands your expectations and desires. It's important to be candid with your surgeon about the results you want. We try our best to help with this by ensuring that your surgeon is a highly experienced BAPS or BAPRES member.